Good morning, Illini, and welcome back. I'm Matt Schrock, as always, your host here at Healthy Illini, and we're excited to jump into today's topic. It's kind of a little bit different for us here at Healthy Illini. It's not one we've really touched on much to this point. We kind of bumped up against it in a few ways, but we're talking healthcare technology today. So I'm excited to have our guests join us. Today's guests both come from Student Affairs Technology, which Student Affairs is one of the units on campus. It kind of oversees a lot of different things. We talked about that before. McKinley, the ARC, Counseling Center, housing, things like that. And so we pulled from their technology department to get our guests today. First up, we have Dr. Mel Fenner. He is the Director of Health Technology with Student Affairs Technology and has been in IT in some sort of capacity for about 18 years. Mel, I appreciate you taking out the time to be with us.
Yeah, this is actually really exciting. So thank you for the invite.
We also have Abby Nicholson. She's with Student Affairs Technology as well, mainly with McKinley IT. And she's a little bit newer to the field. And so we're going to get a perspective on both ends here a little bit today. But Abby, thank you also for being here.
Yeah, thanks for having me. I'm really excited.
So Healthy Illini has been on the air for a little over a year now, and we've talked about a lot of ideas and a lot of programs, a lot of aspects of health and wellness. And like I said, we really haven't talked a whole lot about the technology side until today. And we live in a very tech-driven society. We know that. Obviously, you're listening to this on some sort of technological device. And there's really literally no aspect of our lives that isn't influenced in some way by some sort of technology. So let's start there real quickly. But why is there a need for technology to be intertwined with healthcare?
I mean, that's a pretty loaded question. Given the fact that everything we do involves technology. I think one of the biggest examples was from the last couple of years with the pandemic. We had our Safer Illinois app that was heavily technology driven. That whole technology ecosystem, that could be a whole topic in and of itself. But situations like that where you need quick responses, technology is really beneficial. It really is involved in everything that we do. The other piece is it's very difficult these days to hire staff in any department. People are finding other things to do or retiring, not sure which, maybe a little bit of both. But needing to kind of overcome those challenges of a human doing something a lot of times requires technology to replace that aspect. A lot of people are scared that, technology is going to replace my job. And in this case, these days, it's like the humans aren't even there to do the job. And so we have to put something in place to just kind of keep the ship rolling, if you will.
Yeah.
There's an element of balance in that too, because with healthcare, there are certain things that you're always going to need, a human aspect to it, and technology might not be the best option in and of itself. But at the same time, you can't really separate because so much of our lives is determined by technology, how we disseminate information, how we interact, how we just even approach our lives and our schedules. Like keeping track of calendars, or even how do I get from one point to another point is all technology. Mm-hmm. So it makes sense to intertwine that with healthcare, to start to look at ways that technology is being used for a social side could also be used for the healthcare side as well.
Absolutely.
So, but it's not like we haven't already jumped into some technological, let me say that again. It's not like we haven't already jumped into using technology in healthcare spaces at McKinley. So before we start talking about the future stuff, which is what I'm really excited about, but I do want to talk about ways that McKinley is already utilizing technology to serve students, especially in ways that they may not be aware of, kind of behind the scenes kind of thing. What's going on at McKinley? What have we done? What's happening right now that students should be aware of?
So one of the things that we've implemented, and I'll let Abby talk about it, is related to dictation. And just to give a quick synopsis, what a lot of patients or students don't realize is that when their physician is seeing them in the room, a lot of times they're going back somewhere else to record what happened with that patient visit so that they can put those notes in the chart. And traditionally, we'd have a staff of people that would listen to those recordings and type in the notes just to make sure that if a student needed a copy of their medical record, they'd have a full set of notes from that appointment. But again, going back to labor shortages, it's not that easy to have a staff. And so we've really switched up our dictation model. Abby, you want to
Yeah, so now the providers are able to go directly back to the room, and I've heard from a lot of them they do it almost immediately. They'll go back and they record, and it's just like talking, speech to text on your phone. It's basically the same thing. So they're going back and they're able to put those notes in that chart immediately rather than waiting for, a transcriptionist or whoever to put those in there. So, as far as the students, I know a lot of times I go back and look at my notes that my doctor wrote, I don't know, if I forget something or I'm just curious what they had to say. So now they're able to see that immediately rather than, having to wait a couple days and, wonder what this was or something along those lines. So yeah, and the providers really seem to love it, and yeah, it's been really great so far.
Yeah, so we implemented what's called front-end speech recognition. So like Abby said, it's kind of like, speech to text, talking to Siri or Google or whatever, but except for medical terminologies. And it's able to translate a lot of different dialects and individuals from different countries with a really high percent of accuracy. And it's been game changing.
Oh yeah.
And I think that's something that students might not understand is that for using dictation and for that speech recognition, that's a high bar for a medical field. It's not like my phone when I do it, because I know when I speak speech to text for my family or whatever, half the time they're like, "What did you just say?" Because that's not at all what I was saying right there. And so you have to. There's a high bar for this, and so it's it's very involved to have that technology, and it's something that's behind the scenes and nobody sees.
Yeah,
and it's a huge. I've been a part of some of those conversations, those meetings. I've heard it. This is a long process to get there, but it's something that once you find that technology that works, it is a game changer. It just absolutely frees up a lot of stuff to utilize manpower other places, but it's a huge aspect of what we can do here. One of the other things we're doing and kind of the behind the scenes, if Mel, you want to talk about it a little bit too, is patient surveys, because we want feedback from students, but that's not always easy to get.
It's not.
So how has that advanced here in the last few months?
Quite a bit. We're really trying to get, like you said, more feedback, because typically we would send out surveys maybe a day later or so and send it to a small batch, and it would be a lot of questions. And anybody that takes surveys, they look at it and they're like, I don't want to answer all those questions. And then so we get a very low response rate. And so we switched that up quite a bit, where initially it's just a few questions, just a couple questions like, how did you do? And using some of the intelligence of the data that we have, we're able to hide the questions that are not relevant to you, just so that, as a patient, you're not looking at this long survey and you're like, that's not applicable, okay, this is just wasting my time, so now I'm going to close the whole thing, right? So we have more focused questions to get to the root of the services that you provided and get a response to those specific services. I know we've also been looking at using QR codes to place around different locations. So you scan that code and give some quick feedback right then. It's really all about capturing that attention in the moment, because we're all busy, right? As professionals, we're busy. Students are busy. We were all students once. We get it. And so we don't want to burden people with a 20-question survey later. We want to capture that feedback right away, even if it's just a quick yes or no, I enjoyed the service that I received.
Well, it's the same reason we do the dictation immediately after a patient visit, because it's fresh. It's
exactly
there. And so it's the same idea.
Yeah.
And so, that's a huge part. My next question is kind of going to be what's happening at McKinley is going to lead into what's coming possibly at McKinley. And that's kind of where I want to get to, some of the possibilities of the future of health technology, which again is a loaded question because there's so much there. Yeah. There's everything from, this will probably happen in a week, to maybe it'll happen in a couple of years, to, I don't even know if that's even possible kind of idea. But we're looking at things that can impact our community here at UC. And one of the things that McKinley has done that we're talking about advancing is vending machines. That's a technology. It is. So there's one vending machine on campus right now. If you would just quickly share about what that is, and then how the success of that particular machine, how that's building into more possibilities here on campus.
Yeah, so that we've got one vending machine at SDRP that has mostly over-the-counter related items, and it's been wildly successful, right? I think it was implemented spring of 21, and I understand that it has to get refilled very often. And so the hope is, first of all, it's in a very good location, right, at SDRP, a lot of foot traffic there. The hope is that we can add more vending machines around campus, but also go beyond just over-the-counter medication and have even potentially lockers that has some common prescriptions, so that You see a doctor via telehealth, which is something we didn't quite mention yet, but we've been doing telehealth since 2019, even before the pandemic, thankfully, because when the pandemic hit, we already had telehealth in place. It was just literally training more providers, right? But understanding that some students don't necessarily want to make the trip all the way to the physical building, could be seen via telehealth, and they could have their prescription made available to them in a locker somewhere centrally located on campus. So that's going to be a really big deal when that comes out.
And we're also, I know, we're looking at some more advanced vending machines, like touchscreen type of thing, and just giving a better immediate response to the need kind of idea. And again, that's all technology.
It's all technology. And, a lot of times, at least personally, I like to draw inspiration from what other organizations are doing. And I was in the airport the other day, and I saw a CVS vending machine that was like this big vending machine, big glass, view where you could see everything that was in it, and a touch screen to pick what you want and pay for it with the credit card. And I shared that with the leadership at McKinley, and it's certainly something that's on the list to think about. Of how interactive do we make the vending machine? What items do we have in it? And how do we again kind of make that really rich experience for the users that are going to use the vending machine? And
Abby, coming back to you, like we said, you're a little bit newer into the IT field as an employee. You were a student not too long ago.
Yeah.
What are you seeing in this field as far as the technology advancements and the things that are coming? What are the things that you're kind of exciting you that you're looking forward to?
I would say, like things like this and using like robotics and that kind of thing. I think it's, extremely interesting, and I do believe the younger generation who are typically students, they're going to absolutely love things like this. It's easy, it's accessible. They don't mind using technology. In fact, I think they kind of love it. So I think that it would be, like those kind of things, especially here at a college campus, will be super beneficial and effective with our students.
What kind of things are we seeing in robotics? That's again a big. Are we talking androids walking around kind of thing? You hear robotics,
Terminators.
You hear robotics.
I hope not.
Skynet's coming. What kinds of? What does that mean for robotics? For a college campus like this, what are the possibilities there even?
Yeah, first of all, the possibilities are endless, but we will stick to very ethical robotic options. Right? We're not going to have Skynet and Terminator stepping through the front door. But, going back to that labor shortage piece where during the pandemic we had, for example, a greeter at the main entrance that was helping facilitate, making sure people had masks on, pointing them in the right direction. It's hard to find a person that can do that job and keep a consistent employee there. And so having a what they call a concierge robot that kind of stands there at the front door and talks to people, right, and points them in the right direction is one very reasonable example that is not too far-fetched that we could realistically see in 8 to 12 months, 18 at the most, 12 to 18 months at the most at McKinley. At least that's our vision. Kind of helping direct traffic as people come in the building.
Well, we've already got the chat bot on the website that responds directly to inputs, and that's basically the same kind of idea. You just have a more physical chat bot.
More machinery standing there in front of you. Yeah.
So it's in some ways it's wild to think about, but at the same time it's like it's not really that wild to think about in the world we live in.
Oh yeah.
And that's really exciting. Mel, you mentioned in the prep work that you're part of the Smart Healthy Communities initiative, and this all kind of falls into this whole visionary thing. Would you share about that a little bit and what it is and how it's impacting you at UC?
Yeah, so the Smart Healthy Communities initiative is the team that is working on the Illinois app and the Rockwire open source platform. Again, a whole different conversation for a different day, but the summary there is we're creating an app for campus that we hope to be smart and intelligent, that is personalizable, that knows who you are. Obviously, if you allow the privacy settings to be such that we can collect your data and it is stored encrypted, and privacy settings and all of that are very central to it. But with that, we're looking at things like behavioral nudges, right? So if you're not doing good in a course, or maybe your activity on campus is declining, maybe just getting a gentle nudge to say, hey, are you okay? And if not, having a human reach out to you, right? So with that, we're really trying to pair together the human element and the electronic element, bots in the app as well, chat bots, that can, again, just kind of make the community smarter, right? Make it a little more accessible. And so we've got a pretty long roadmap of stuff. It's just kind of getting one thing at a time developed and made available to campus.
And all these things you're talking about, like the nudging, the reading data, it's all stuff that's already happening in certain aspects in the world. And so it's just taking the things that that we do in a social aspect and giving it more of a pointed focus of healthcare,
right?
Kind of thing. I mean, I think about the nudging, like, oh, nudging what? I mean, I'm sorry, Netflix always asks me, are you still watching?
Yeah.
I mean, that's a
right?
gentle nudge.
It is.
Now, and there's certain shows where it doesn't because it knows I'm watching those shows. You know, it kind of learns a little bit, but that's basically the same idea. Is just taking it from that casual entertainment side and putting it into a functional side for health and well-being, which is. It takes a little bit of a mental shift.
It does.
But it's not that much of a mental shift. We start working and thinking about it and stuff. And then, and technology changes so quickly that it moves so rapidly. I mean, we start talking about things like Twitter, how fast that became something, TikTok, how fast that becomes something, and Apple Watches, just there's so many, we could just go down so many of the different things, and tying that into healthcare is just, really, it's a natural progression on that. Now, like I said, we could talk about this forever. I do want to get to one last thing here, which is not necessarily technologies. It's not about the technology, but more about the innovation side of things. We're blessed that we are on an incredibly diverse and creative campus. I love it. I love seeing all the things that are created. I love all the energy that we have here because we have people from all sorts of backgrounds and with different goals and different ideas and experiences and things like that. And it's something that you both talked about in your prep work today, that there's not just a desire to see diversity in this space, this technology space, but also a functional need for it. Why is that? Why is there a need for that? And why is it a key component? Why is diversity a key component when it comes to innovation?
I'll let Abby take that and I'll follow up.
Yeah. I feel like, getting different perspectives from, everyone is a great, in our case, I work with all men who are a bit older than me. I'm a young 24-year-old woman that just got out of college a couple years ago. So I feel like, my point of view might be different than theirs. And I feel like I can give really good feedback and suggestions on what, people my age are kind of looking for. So, I mean, and that's just for anybody, everyone's different. So I feel like, every age group, every, any kind of diverse area, everyone's going to have something different that they're looking at. And I think, you put all that together and you might just find something that's perfect for everybody. So, yeah, I don't know. I think it's a really interesting thing for sure. Because I grew up with technology, others didn't. I don't know. It's just, I think it's really good to have just a little bit from everyone.
That's a really good point. And I mean, the audience can't see us, but, when you think about technology, Abby being a young female, me being an African-American male, those are not two types of individuals you typically see in IT, if we just keep it real for a minute. And so, that in and of itself, I think is pretty telling of how we operate, both at McKinley and at the University of Illinois. And so, bringing those different perspectives to the table definitely helps check the box of the different groups of people that may be using the technical tools or obtaining services, and you're really able to cover different sets of individuals, because healthcare in general is not a one-size-fits-all. Technology, as much as we try to make it so, is not a one-size-fits-all.
Oh, no.
Right? We can't train one person the same way we train somebody else. Even when we're working on things in the Illinois app, we're always taking a broad perspective because we know our campus is just chock full of diversity, from different nationalities to genders, races, all of that. And so we've got to account for that, because you don't want to leave anybody out,
Well, and that's the thing with technology, is that with those different perspectives, everyone has a different need. And so, we talk about an app. Well, the app has to be functional in different ways.
Right.
For instance, some people are always like, oh, I just Uber here and there. I live 45 minutes south. I've used the Uber app in my town just to look. No, there's nobody. I mean, nobody's Ubering in my town of 2,000 people. It's just not happening. And that's fine. That's okay.
Right.
And we talk about, the needs of a healthcare app for somebody like Abby, you're 24 and no kids. Mel, you've got a couple young kids. I've got a senior in high school. So we would all have different needs in that realm. And having that representation of ages, of races, of backgrounds, of socioeconomic, all that stuff, it all plays a part. So there's a need for that diversity to get involved in it. And as we are a very tech savvy campus, as people are understanding that, hey, we can start using this for healthcare as well, there's going to be some crazy innovations that are going to come. And I mean, if you have questions, follow up with it. We could talk about things like, I know there's drones or something right now. That's a real conversation that I know Mel. If I wanted to, I could do a whole drone podcast with Mel.
There's always drones in the back of our minds about how can we deliver things with drones, but we'll get there.
And it's exciting to see what's coming next and how quickly ideas are popping up and how they're going to be implemented on this campus. And so if you're listening, be paying attention, because we're pushing forward. We're doing it in a way that is functional and economical and ethical, but we're definitely looking to push the envelope as much as we can and be a leader as much as we can.
Absolutely.
Just in the college health space. So thank you so much for both being here. I really appreciate it. It feels like we flew through that, but it's a topic that I enjoy talking to you both outside of this of a podcast, but I appreciate you taking the time to be with us today.
Thank you.
Absolutely. Thank you for the invite. And we'll be looking forward to series number 2 of healthcare technology.
Technology is a huge part of healthcare. It is. In some ways you see, in some ways in the background, and McKinley and UAOC are no different than that. And we're looking to push that envelope and develop some new things to not just to be on the cutting edge, but to better serve our students. And so if you're listening and you have questions, you want to know, hey, I want to know more about this, I would love to hear a series about this part of technology or what's coming next, or I have questions I want to ask. Contact us at Healthy Illini, contact us at McKinley, and we'll be happy to have those conversations with you. There'll be some resources in the bio for how to contact us and things like that. But we want to continue the conversation. This is just the start of it, and we know that technology is going to be moving rapidly. We want to be on the front edge of that wave, riding it into whatever comes next. But thank you for joining us today. You're on a personal journey no matter where you are in it. You're important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.